Echo Rock the bus behind the 744 Gage Avenue on 750 Gage Avenue.
It's non-stop arrest, but then you get there and like they're just a DOA.
Yeah.
Not just, but you know what I mean. Like they've been dead for a minute, so.
Shoot.
Yeah.
All right, so this is Julie and Pete from Rush the Bus. We got Ian, Dwayne, and Maria, and we're just gonna, talk about like what everybody's doing, and
During
some of the
COVID.
things, the COVID thing. There's a lot of people who aren't seeing it, so we figured we'd come on here and just let everybody know what they're in for. So so basically, Maria, what do you see in Manhattan? What do you got going on in Manhattan?
Well, I worked tour once, so it's still crazy. There's less units running.
Yeah.
Like I was saying before, a while ago, or the norm is to get a lot of nonsense calls, and I would say maybe like 25 to 30% of the calls that we got, before were legit calls. Now it's like maybe 5% are not legit calls, so it's all arrests and diff breathers and just like nonstop, and it's just like exhausting, not only like having to deal with the type of calls, but also like the whole deconning and everything in between and restocking. It's just like a long day. So
it just doesn't quit, man. It doesn't.
Yeah, and then it's like in the beginning, like you kind of had an idea of what kind of symptoms to look for when you got like a semi stable patient, and now it's like evolved so much that it's like it could be anything. I've had like people complaining of like stomach pain, and it turns into like check their stat, and they're like statting in the 80s. They're totally hypoxic. I'm like,
we had some chick the other night where like, it came in as like a seizure job, and we get there, she's just acting weird, and are you drunk? This, that, and the other thing.
Yeah, we thought maybe she was like a behavioral issue or like mental kind of illness.
Weird. And then we're like, all right, come on, you're going. She's like throwing herself on the floor, the whole code 7 thing. Yeah. Then we get on the truck, her stats at like 70. We're like, oh.
And she was
still alive. Like, bro, like, wait till you see this. People's stats are in like the 60s. And
like phenomenally low.
And they're fine.
Yes. Yeah. She was 26. She was 26 years old.
Yep.
She was warm, pink, like she wasn't cyanotic. And yes, like 70%. I mean, we were shocked. Yeah. Like we put her on, we were going to check her sugar because I was like, all right, this chick's acting like a wackadoo. And then all of a sudden, like the monitor's beeping and it's like 70% on the pulse ox. It was like really shocking, Yep.
That's okay.
Yeah, that's been a weird thing, like where folks are actually not decompensating and then they decompensate really rapidly. Like they're sort of maintaining themselves at these like insanely low saturations. And then all of a sudden they've done that for probably like 10 days at home, a fever, cough, weakness for 10 days. And then by day 11, they're like in respiratory distress and like needing a tube.
Yep. And then the persistent PEA. So,
yeah.
So, yep. Dwayne, what do you got, man? You're a day guy. We don't know nothing about this deal.
It's just as hectic as the nightlife. It's tour 2 is always been busy, just as is tour 3 or tour 1. But same things. Those numbers are astronomical. I can't fathom how crazy they are. Yeah.
And you did how many? What were you doing? A couple arrests a day, right?
Pretty much, yeah. Yeah, 3, 4. I mean, today we did a short shift, so it was only about 2. But like I was telling you before, we were on scene for a while, so. But you could still hear them coming over the radio, left and right.
Yeah,
nonstop.
That's
the crazy thing is like they're everywhere.
Somebody posted like a picture the other day. Our lieutenants run like 12-hour shifts, and they're basically assigned to cardiac arrest calls. Like lieutenants have to go to cardiac arrest. And one lieutenant in 16 hours did 13 cardiac arrests.
Good God.
Yeah, think about just how much that is on a person. Like that's all you're seeing all night, It's shocking. Like it's actually really scary. Like I feel like 4 weeks ago or 5 weeks ago, you know, we were talking about like family vacation. Like my dad was like, oh, I don't know if we're going to be able to travel internationally because of this COVID or coronavirus. And I thought to myself, like, Dad, you're being like really extra. You know, I was like, this is like the flu. And I'm like, no, it's like the apocalypse now. You know, like this is actually like legit. So.
Yeah, and I've been talking to like my friends and stuff, and everybody like, you know, they're like, oh, what are you seeing? How's it going? Whatever. And in the beginning, I was you know, thinking the same way. I was like, this is nonsense. It's going to be another flu.
Yep.
You know, everybody's being super extra, being like psychotic and buying too much toilet paper and what the hell. Yep. And now I'm like eating my words, and I'm like freaking calling everybody. I'm like, no, everybody's dying. Like, legit, like stay home.
Stay home. Yeah, stay home. Yeah.
And that's, you know, the thing, especially in the city that I've seen, is like people just don't get it. I don't know if you saw it today. They had like a post about like how packed Central Park was, because it's actually super nice out, and people just don't get it. They're like right next to each other, and like, you know, not even everybody has a mask, and even if you do, like that doesn't help you 100%.
No.
So it's just like nuts that like people are just like out and about, and the whole thing about like, okay, only essential workers. Like I thought that was going to help because people aren't going to work, but guess what? Now they're home doing nothing. They're bored. So they're going out and they're just hanging out with their friends and going to the park and doing whatever they want to do. And like, they just don't get it.
And I think,
they're not helping the cause.
People are assuming that if they're outside, they're not going to be exposed. And I think like, especially in New York City, like a lot of us live in apartments, like you kind of feel cooped up. You want to get out.
Yeah, you got me cooped up. I'm like outside.
Yeah, I know. I mean, you have a backyard and stuff, but, and so do you, Dwayne.
Well,
like,
Dwayne,
but most people kind of, you know, live in an apartment building and don't really have a balcony or a yard. So I get wanting to like take your kid out or whatever. But like, I went to Flushing Meadows Park today to kind of like chat with some of the mutual aid crews who had come here. And there's like a little skate park right by where they're posted. And it was packed. It was packed with like, you know, like older teenagers on their skateboards, younger kids on their scooters and skates. Nobody has masks on. And I'm like, you know, the reality is like, there might be someone in there who has COVID, and now you're like breathing in the same air. There's like these microparticles in the air. None of these kids have masks on, and God forbid like someone fall and break their ankle or their wrist, you're going to go to the hospital, you're going to be exposed to it, then you're going to come home and expose everybody in your house, everybody in your apartment building. You know what I mean? Like people are walking in, they're touching the mailbox, touching the washing machines, touching like the elevator buttons. So it's like people are getting exposed and their loved ones haven't even been outside of the house, you know? Like we're going to people's houses where they're like, oh, I mean, I don't think she has COVID. Like she hasn't been out all month. And it's like they 100%. Yeah, but they have it, like 100%. They have it. They got it. They didn't have to go out. You know, someone brought it in on some grocery bags or whatever. Like they got it, you know?
Ian, what are you seeing down there? You got a lot of COVID people or just like suspected stuff?
Actually, listening to you guys talk about it, I'm actually kind of surprised because I kind of feel like especially after hearing you guys talk about it, we're kind of on the, like behind you guys like a week or so, because we're seeing plenty of patients. I checked the numbers today. I think Florida has like 13,000 cases or whatever.
Okay.
Wow.
But as far as contact goes, and like we're at a stay-at-home order as well, obviously as the country. But like you're saying, unless it's like the Disney area or the attractions area, I mean, my wife and I were just talking about it today. We still see people going to Publix. People are still driving on the roads. I mean, they closed down the parks, but you know, that's easy to walk into a public park around here. And I just feel like it's going to catch up to us at some point. Like our department is, if you have a cough, we treat you, you know, like you have COVID, basically. Anyone that's sick on any level, we treat. Like you've already been confirmed. But I feel like the level of confirming patients and the level of contacts is going to increase. And with you guys being so densely populated, you know, you guys are seeing all the effects up front a lot, and you're catching a lot of this stuff up front. I just feel like for whatever reason we're behind the curve like a week or so.
Can I ask you a question, Ian? If you know, it sort of hit us pretty hard in New York, and we're playing the catch-up game. And the catch-up game for us is literally almost every day that we go into work, our protocols are changing. Something different's coming out that we need to accommodate for what's going on out in the public. Is it the same out there for you guys? Like, have you seen a drastic change in your protocols or?
Yeah, it is, man. Every shift is something new, and I mean, 2-3 times a shift sometimes they'll come out with IBs with updates. Hey, now this is changing. Hey, now this COVID alert, we're changing the criteria. Hey, now the response to the calls and who we send is changing. So yeah, it's changing constantly, man. It's a constantly fluid thing.
Okay.
What are you guys wearing? You guys wearing Tyvek suits and stuff? Because like I heard some in like different counties, like they're wearing Tyvek suits and hazmat job,
Shoot, not even, man. They gave us N95 or a surgical mask, one of those paper plastic freaking aprons, and some gloves and goggles, and we're like, hey, sorry, have at it.
Yep. I don't know. I think like people are gonna burn through all their stuff. Wearing all the hazmat.
Yeah. It's crazy. We stopped sending our suppression units on calls because we were blowing through the PPE too fast, and we had to give our extras to our rescue crews.
Yeah.
We had to lock away our stuff because some other workers that were working on our stations were stealing it, and I'm sure you guys have been dealing with it too. It's just crazy.
It's gonna be interesting. So
like we had isolation suits, like the isolation suits that we carry generally on the ambulance have like the hair net thing, and it has like the things that go over your boots, and it has the gown, and I guess they ran out of them. I don't know, but at our
they ran out.
Yeah, like now we only have basically
Mayor de Blasio is making more now. You saw that?
I know. Well, because he said something like, "Oh no, we're good. Like everybody has gear," and I'm like, every day I'm putting my hair back, and I'm like, I don't want my hair, like, not that it's in my face, but I'm like, not for nothing. It's a problem that for women, like who have any kind of longer hair, or I mean, I'm sure guys do too, but you don't want to go into someone's house.
Yeah, Peter.
I had to I had to do favors. I had to take vitals for an ER tech the other day to get her hair nets.
I know he did. He got me a few nets for my hair, but I'm like, I just went on Amazon to order a bunch of like hair wraps or hair nets, and like literally you could go down the list. It was like, none available, unavailable. Hey Neil. And like that's it. People are buying them up. And when I went to Woodhull the other day, like the girls who were in the triage area had literally taken the isolation gowns and basically cut them up and created like hair wraps, because it's like you don't want to expose yourself, and you don't want to have to literally wash your hair every single day, because I mean, when I come home from work, I'm showering and like scouring my skin every single day, but it's like to have to wash your hair constantly because you're like out there. Gross,
I know nothing of this struggle.
I know. He's good.
I know, but like for women, it's I don't know. You don't want to be touching people who are coughing.
Like we know, this is from day one has been compared to the flu, and flu it's transmitted in certain ways. Now, I think again, along with the progression of this virus itself, a lot of us don't know. Me, myself included, what's the best form of protection? Will the hair network, do we all need to be encapsulated in, a bubble suit? Like, is it sufficient enough with just the N95 and a face shield and maybe a gown? Like, because I still don't even feel that way. I feel like, when I go into a house, my back is touching something because my back is open, and now I got to take off my shirt and wash that immediately. Like, I don't, a lot of this is of course still scary and new to us, but what do you guys think is the best form of protection? Okay, all right, there we go.
I don't even know. So Neil had a COVID explode on him the other day.
Really? Yeah.
Right, Neil?
I don't think.
He's an exploding COVID patient. So I think he exploded. Apparently they do.
Scrub wire brush. That's I mean, after the call, I came back to the station, and I washed myself down, and I obviously changed my clothes and stuff, but I went home from work and I showered and everything, but like there's only so much that we could do, and I just had a Zoom meeting, believe it or not, with my union, and we're looking to maybe, expand out the protection for our members, and obviously you guys are included as well, to maybe face shields instead of goggles, and maybe actually, like, we're definitely exploring respirators.
Oh wow.
Wow.
We know that the fire department is falling short on protecting us, and we're concerned about everybody. We're concerned about lieutenants and captains, but also our members that are under us, which are the EMTs and paramedics. And
I don't know about the captain concern. Are you really concerned about captains?
well, we're concerned about.
I'm not.
I understand. We gotta. There's there's captains that are out there too, and like they're part of our union, and we're concerned about everybody. You know what I mean? So.
Well, yesterday was Neil's first day on the road, and I remember he said to us that it was kind of weird leaving somebody at home.
What do you mean leaving someone at home?
Remember that person we had? He was kind of that was new. Like, that's one of our new things. Like, we're just leaving. If you don't want to go to the closest hospital, we're telling you, sorry, pal. Take a cab.
Yeah, we've been like super busy with just. Before it's like, okay, you it might be a BS call, but if you want to go to the hospital, we're gonna do it. We'll take you.
Yeah.
Now it's like RMA. There's days where like it's all RMA. I'm like, if you go to the hospital, you're gonna get it. Yeah. So and a lot of like very sick people, and then also the change in protocol where now we can give them medications or treatments and not call. That's freaking awesome.
I know.
Awesome, because I used it the other night and I'm like, wow, like this is the way it should be.
Yeah. We treated someone for an allergic reaction the other day. We gave Benadryl, we gave dexamethasone, and then I called telemetry like, do I have to call? And they were like, nope. And that was it. I was like, oh, okay, so we're gonna take the RMA. We just like took her IV out and left. But I mean, the call that we had the other day with Neil's our supervisor, he's our lieutenant, and it was a pretty sick patient. I mean, his sats were kind of low. He had like a lot of cardiac issues, and his family was like really adamant that they wanted him to go to this like faraway hospital, and we were like, that's just unfortunately not a possibility.
No more trips to BI. You too late.
Yeah, and that's it. And we're like, I'm so sorry, like he does need to be seen by a doctor. He should be seen. But the reality is, like, he's going to go by himself. He's not going to have any advocate for him. And he's not going to be able to go to the hospital that you guys normally go to, like the doctor's at. And the family chose to keep him home. And it's like one of those really weird, like, you have this almost ethical conundrum where you feel like in any other day, you would have 100% taken that guy to the hospital, 100%. And we're like, this actually is probably more detrimental to him. Like, if he talks to his doctor tomorrow, or you guys talk to his doctor tomorrow, then you might have a different outcome. But for us, like, it's almost like certain death. Like, we're going to take this guy to the hospital, and that's it. He's probably not going to ever come home, It's like a really weird time for us to make those kind of decisions. These are like ethical decisions that, not that we didn't have to make before, but now more than ever we're making. Like, we're basically doing triage every day. Like, are you sick enough to need going to the hospital? And if you're not going. Like, we're triaging you back to your home. That's it.
Yeah, that's kind of nice. I wish they'd let us do that. It's, if you want to go, you go regardless for us. So
really,
yeah, they call it customer service, but I just feel like it's the opposite.
Yeah.
So,
usually,
but your hospitals aren't like, your hospitals aren't as bad as ours are doing now. I mean, with the amount of patients, are they in Florida?
Well, probably not, honestly. I mean, our busiest hospital, downtown Orlando, is probably still nothing compared to what you guys are dealing with. So, I mean, in all honesty, but.
And Ian, that might change for you guys. Like, you might see as the coming weeks happen that you really are like leaving people at home, because the reality is, like, there comes a point where we're going to people's houses who have a cold or have a cough, have a fever. Like, in all likelihood, they have COVID or they've already tested positive for it, but their vitals are great. They're satting okay. And we're straight up telling them, like, you know, it's better for you to stay home. You have family here that can take care of you, because you're going to go to the hospital. You're going to be alone. You're going to be sitting in a chair all night, because if you're ambulatory, they're not giving you a bed at all.
Yeah, for sure.
And so,
and they're sending people back home once they like, you know, are like stable enough to go back. They're not going to treat you for anything. You know what I mean? Like, there's people that are a lot sicker. Yeah.
Do you guys have thermometers down there or no?
Yes, we do. Yeah.
I know, like we don't have thermometers. I know, it's like
not even the crappy forehead ones.
Nope. What a great tool that would be to have. You know,
my partner actually has been carrying a thermometer that she got as a gift for Christmas, and that thing has saved us like so many times, because there's been times with like people not showing any signs or symptoms. We check now. The first thing we do is check their temperature. We had a guy that was at 106 on the temperature.
Wow.
Like your brain is probably fried right now.
Oh my God.
And other than that, like he had no symptoms.
Wow.
And then we checked the sat, and he was sitting at 76 on room air. Not showing any other symptoms or any, you know, distress, and like 106 is like, whoa.
Yeah, you're cooked. So,
But if we hadn't had that thermometer with us, like, I mean, he feels hot, of course, but like, we don't know exactly.
Yeah.
Definitely something that we, especially with this virus, it's like it should be part of what we carry.
I know.
Yeah.
I know Neil had asked for thermometers and stuff. They asked for them, right, Neil?
Yeah. No, I mean, I brought that up to my union to ask actually the department, and many weeks later we came out with pulse oxes. So pulse oximetry is a great tool, but the problem is that if you know how to do a proper patient assessment, you don't need pulse oximetry. You do need a thermometer.
Yep.
We do wear gloves, and depending on, you know, the agency you work for and the thickness of the gloves, you may not pick up on especially a low grade fever, which is what, you know, a lot of COVID patients have through the glove. And then next thing you know, you're missing a sign or symptom of something that's going on. So
Yeah,
I had a call the other day with a BLS crew. They originally got the call as a sick call. When they got there, the female, she was, I think, in her 80s and having like a really hard time breathing. And I don't know. I also teach on the side, so I like to have like a little teachable moment after each call.
Yeah.
Like I won't call you out on scene, but you know, afterwards, like, what could we have done different? What did we learn with this? What did we do right? What did we do wrong? You know? And my partner gets annoyed at me, but I'm like, if you can bitch and complain about something that went wrong, you're not doing anybody any favors, right?
Yeah.
So you can say it nicely, and you know, this is a teachable moment for everybody. So anyway, they rushed to bring the patient down, and they were waiting downstairs for us, and obviously almost in respiratory arrest, the lady, right? So we ended up tubing her and everything. So they had a pulse ox with him, one of them, and she, you know, after the call, I was like, you know, why did you guys not like bag her, right? So they were like, oh, you know, I didn't see the pulse ox. You know, my partner had it. And I'm like, okay, so first of all, don't throw your partner under the bus. You work together. And then second of all, I'm like, so what if you guys didn't have a pulse ox? Like, why are you not treating what you see? Because she was obviously showing signs of distress. Like, look at her belly. Look at the way she's breathing. Look, you know. So that was kind of like a teachable moment, like not to treat so much the equipment and the numbers, but like to actually look at your patient, along with what like Neil was saying, that you assess the patient correctly. So, you know, the pulse oxes are great, but
I don't know. I've had quite a few patients though that their pulse ox was pretty low, and they weren't really displaying that they were in distress in any.
Yeah, the majority of them are not.
Yeah.
So
and if you're,
I think it's altitude change. You know what I'm saying? Like you change the altitude or the temperature, and that's when they shit the bed. You know, like the CHF when you bring them outside and they flash.
Right.
So I'm wondering if that's might be the thing. You know?
Yeah.
it's definitely
because
I saw
it's a quick. Oh, sorry.
Yeah, go ahead, dude. Go ahead, dude. Finish.
It's a quick it's a quick decline. Like you know, they're sitting at like 60 and not showing any symptoms at all, and then 2 minutes later, they're literally in respiratory arrest. Like it happens that fast. There's been plenty of times where same thing. I responded to a BLS crew, you know, for whatever reason, and they said, yeah, we were talking to them 2 seconds ago, and all of a sudden they're doing CPR as soon as we get there. You know, like it's the weirdest thing.
Yeah.
I think that's the weird thing about the COVID situation too, is that like we had a patient, one of our last jobs, not last night, but the night before, was like, the family said like she's been home for 11 days. 11 days she's been like doing okay, or at least had a fever for 11 days, but for 11 days she compensated. And when we got there, she was breathing at like 40 breaths a minute. You know what I mean? Like she was blue, her lips were purple, like, and you're kind of like, holy shit, how did this like just happened in an instant, you know? And I mean, we had a guy the other day too who was like not doing so great. He'd been taking his own inhaler thinking it was an asthma kind of thing, and his family's like, he hasn't been out, like he doesn't have COVID, you know, like he has no fever. And it looked like a kind of like a heart failure type of deal, like he had pedal edema and stuff. And
yeah, his pressure was up and everything.
Yeah, his pressure was up, his sats were not terrible. And we ended up, you know, treating him with albuterol and then realizing like, oh, that's not great. Like that didn't work out so well. And then kind of like treating him with nitro and CPAP, thinking like, all right, it's a heart failure thing. And then that didn't work out so great. And he got like we basically got to the hospital, and A, the doctor yelled at us for putting him on CPAP, and then B, like tubed him almost instantaneously.
That's what I was going to ask you guys. Have you guys been yelled at yet for using the CPAP or even the non-rebreather?
You know, and he was a CHFer, and you know, we had him on CPAP, and the doctor just was like, he's COVID. So I think that's the other thing we're going to start seeing is, you know, you're going to treat everybody as a COVID, but they're really regular patients. You know, because
what's the alternative? Are you supposed to tube them right away without trying to CPAP?
Well, that's actually what he suggested. He suggested we should have tubed him, but I got to be honest, like we were like 5 blocks from the hospital, and already in our system we have to call to get sedation orders, right? But
that's another thing that should change.
Our doctors are so inundated with calls. Like we called during an arrest the other day, and they had 5 arrests on the phone. So am I supposed to wait for 10 minutes to tube this guy when I could be in the hospital in 7 minutes? I'm not going to wait. I'm just going to take him to the hospital. And the doctor, as soon as we get there, tubed him. You know what I mean? Like he needed a tube, but I can't wait on scene to get that tube. I just got to get the hell out of there, you know? And I mean, if I had a 20-minute transport, like we got to do what we got to do, but we're like right by the hospital. I'm not going to wait on the phone to get you, you know, sedation orders. Like I got to just get to the hospital. And I felt bad for this poor guy, you know, but like it was like he decompensated so quickly. His sats kind of remained high. So like, I'm not entirely convinced it was COVID related, but like, who knows? I mean, at this point, like we're sort of assuming everybody's got it, you know?
And it's the other thing, with the lung sounds are clear with the COVID too.
Right.
Yes. That's so weird.
That's throwing a lot of people off.
Clear in every field. Like you're like, this person is having obviously like a struggle breathing, but their lungs are clear. And then you put them on the pulse ox and it's like, holy shit, they're sitting at 50%. Like, you know, and their hands, their nail beds are blue, their toenail beds are blue, their hands are blue. Like, I mean, it's like we're seeing cyanotic patients like you're like, this is a classic textbook example of what cyanosis looks like. They are purple, you know? I don't know. I feel nervous.
Yeah, it is going to be interesting. So,
have you guys had any like we had a call the other day that we thought was a COVID, and some of the, you know, what the family members were describing sounded like the patient was going to be a COVID, and he was also having chest pain, right? So we're like, okay, we'll do the 12 lead, and it was a STEMI.
Oh wow.
So I read an article, you know, there's like all these different you know, studies going on now because nobody knows what the hell COVID is, and the symptoms keep changing and everything else, how like there's cardiac involvement too. So we went back to follow up on that patient after he went to the STEMI. Like the next day, we checked on him, and he was COVID positive.
Oh wow.
So Like,
Oh,
I don't know if it's.
We read something that has like AFib. It's like causing like AFib now or something. I think Julie had told me that.
There's a lot of like cardiac issues that are happening with the COVID, they're saying.
Right.
And
COVID is causing it, or this is
yeah,
just
causing
it's
it.
It's causing new cardiac issues.
Yeah.
Underlying issues you guys are saying.
Yeah. A friend of mine is an ER doctor. He works at where is he, in Long Island, right? Stony Brook. Good friend of mine, of us and the family, and he said it has a high affinity for cardiac cells. So there'll be a lot of cardiac involvement.
So even like when you get the respiratory
like
that isn't sounding good, it's because it's affecting cardiac.
So it's also affecting the cardiac cells. So like there'll be like a lot of EKG changes, AFib. You'll see a lot of like ectopy, vocal PVCs, MIs will happen. That's really what's putting them into eventual cardiac arrests, as well as the tissue involvement. I'm sure a lot of you guys have seen. I mean, I've been on the desk for a lot of this, but like from one day that I was working, the boss is always getting the cardiac arrest. So I've seen a lot of the red coming out.
The red line.
The red line, acute MI.
Yeah, there's nothing acute about this thing.
On it, but like the arrests where the red goo is coming out, and it's pretty obvious that it's surfactant. It's pretty obvious that it's alveoli destruction.
Yes.
It could be backup from heart failure.
Yeah, it could be backup from heart failure, but I mean, it's definitely not straight up blood.
Yeah.
Julianne, your hair looks good.
Thanks, Anne-Marie. I need a haircut.
Yeah. But me, it looks like it's kind of a mixture. It's almost like when you get like kind of like somebody with a bad trauma, and they have where the CSF is coming out of the ear.
Yeah.
That kind of situation where it's not just blood, it's a mixture of other things
like cells, like tissue,
like surfactant, or like that's like mixing with the blood, and then it creates this like oily bright red blood, but not specifically like straight up like blood, like it's mixed with
that. Yeah, we had that on our first arrest, the COVID arrest.
I know, that was sad. And that we went into this patient's house, and I got to tell you, when I saw the guy, I was like, oh my God, he's super young. And he was actually 75, but he was in excellent shape. Like really looked like he looked like a 50-year-old. I mean, super healthy looking. And basically he was COVID positive. The family said he'd been treated for pneumonia, and he was doing okay. He was at home, like resting, and then dropped in front of his children who are adults. And they basically started, CPR on him. And that was it. I mean, it started as asystole, it went into PEA, then it went to asystole, and all the stuff that was coming out of the tube was like, what is this? Like, what is this shit that's coming up? And I've been reading stuff that in the hospitals, like, and in Mount Sinai, they actually have a video on YouTube that you can look up. They're proning the patients. So they're turning them over, and they're saying that because there's, I guess, all this like destruction of the alveoli and everything, it gives them more space to kind of like allow for oxygenation. And so if they're even doing it, I mean, they're doing it obviously on intubated patients. They're trying to prone them for like 18 hours a day or something, but they're even doing it while intubated. Yep.
Maybe they use one of those massage tables.
It's kind of crazy. If you go on YouTube and look up proning, and Mount Sinai has like a little educational video. It's like maybe 15 minutes long, and they show how all the nurses come. They like put them in a sheet with pillows, and they all like roll them together, and all the central lines and all the intubation stuff has to be like.
They leave them accessible to
accessible.
2 people. We don't need 10 nurses. I watched the video. They got like 10 nurses. Yeah, we can 2 people.
But for us who have patients who are awake and alert and everything. It's nothing that really says in our protocol that we can't do that if that's a position of comfort for the patient. I mean, I'm sure that's a possibility. Like if we can.
Everything's changing. We're 93 in the world.
We might get You may get an order that says transport everybody prone.
I know.
Oh my God.
I mean, that's always the whole like, oh, don't put your patients prone, but there's really nothing that says precisely that we can't. It's position of comfort. And if their stats increase in that position, I mean, obviously don't lay them face down, but like if you're able to put a few pillows under them, make them comfortable where they're in this like swimming position.
Yo, I remember we used to put EDPs face down in the reed. I remember that, like back in the day.
What'd you say, Neil?
I know Neil's our supervisor, so what he says.
Jesus Christ. It sounded like you wanted to say no.
Listen,
Stewart? Tell Stewart I said no.
Anne-Marie says no.
No.
He is a doctor from DOT.
You are not a hospital.
You're not a hospital, right? I know what the
She's not at the BOT anymore. She's in the field.
I know. Anne-Marie's a
guy.
lieutenant and an instructor, so I mean, I get it. But
So can I ask this question also in lieu of trying to get ahead of everything? Like I'm, Anne-Marie knows, everybody knows I'm new as a medic, so being a clinician is sort of a new aspect for me. Now, huh?
You're great. You're fucking great.
That wasn't nobody.
Anne-Marie,
Thank you. But in lieu of trying to, I guess, stay ahead of everything, we mentioned this has a lot of, cardiac results. Should we start looking, like, is there ways that we can try and jump ahead of it? Should we start looking at the EKG first before, we only really do it, when someone complains of chest pain or anything like that. But if it comes across as COVID positive, should we try and look at that EKG and see if we can correct it cardiac-wise?
I'm thinking we're going to learn from each other.
Yeah, I think obviously, like, just, ABCs, which sounds simple, but like most of these people with the airway and the breathing is, but then when you do see those like signs and symptoms that they're not there, it kind of makes it confusing for you to like,
right,
if you have somebody that's not exhibiting those breathing issues, or they're not showing any distress, so it's like super tricky to like figure out. Like same thing with that guy that I had, like, he said he had some mild chest discomfort or whatever, and that's why we did the 12 lead. But otherwise, I don't think, that would have been the first thing to go to with everything that's like happening with the COVID.
I think everybody's going to have to tell each other, like what they're seeing, like if you're starting to see like the EKG changes, like I know the persistent PEA is one of the new things that we heard, the AFib and stuff like that. So I think we're going to beat, like our protocols and the REMAC and what, if we're going to wait for the department to tell us stuff, we're going to be
they're not going to
behind everything, so I think we need to tell each other. And that was like the kind of like the point of this is like, share with
but you can't not adhere to our protocol.
You can. No, you have to listen to the
wink, wink. Neil's on the line. Don't put things like that.
I hear Anne-Marie in the back. Maybe we should consult.
We have to talk to each other.
I understand completely where you guys are coming from. Like I said, I was out there one day. You guys have been out there way more, right? But like, I've been there with you, but like, I'm going to tell you, I understand where you're coming from. I know that you guys are searching for any kind of edge in regards to this situation. But I'm going to be, blatantly honest. This is more of a recovery mission.
Yes, you're absolutely right.
Than it is saving people's lives. You're gonna know who has it. You're gonna know who is salvageable, and you're gonna know who isn't. And I'm not saying that you shouldn't do an EKG. Why not? But the thing is, like, it's like Miranda said, ABCs, air, breathing, circulation. Keep yourself as safe as possible. And a lot of these patients, it's gonna be, hey, are you gonna die at home, or are you gonna die in the hospital? And friends around.
Yeah, that was the toughest thing. Is like, like we wheeled a few people out, and it was like it didn't sink into them until we were putting them in the back of the truck, and they're like, they're not coming back. So Ian, wait till you guys see that. Like, that's gonna be really tough.
That's what I'm waiting for, man. Honestly, like, I'm taking notes, like mental notes as you guys are talking, so I can take the shift, be like, hey man, this is what they're seeing. I'm pretty sure it's within the next week or so.
Yep. So
We're not about being a clinician right now.
No, it's tactical. It's all tactical and speed.
You're taking care
and that's the part I'm not gonna lie, that's the part that scares me. Like I mean, I know, like, you know, Neil said, we're in the recovery position, but it's tough. Like it's hard to walk in there and just say, all right, there's nothing we can do, and walk right out.
I know. This is
that's
triage. At the end of the day, this is triage. This is the biggest MCI we've ever had. I mean, like, honestly, short of like 9/11, this is a legit ongoing MCI. Like, this is not a one-day thing. This is like an ongoing, several weeks in MCI where we're literally triaging people.
Yeah.
Viable and
like I was telling Neil just yesterday, actually, the day before yesterday probably, but I almost got into an argument with a lieutenant because, you know, this whole 20-minute rule, and you know, BLS was there doing CPR for about 16, 17 minutes, and then we showed up because, of course, you know, we're all extended. I had to go away into Queens for the cardiac arrest. And as soon as I get there, the lieutenant was like, don't worry, you know, we're going to call it in like 2-3 minutes. Meanwhile, behind me, the family is beating up the wall, crying and everything. I'm like, Lieutenant, I'm not going to sit here and just wait and do nothing. Like, I'm going to try and do something, you know. And the guy was young too. He had just stopped. It wasn't like it, you know, he had underlying health issues or anything like that. The lieutenant understood because of the situation we were in, but that was one of the hardest things for me to say, all right, I'll stop and I won't do anything. Like, I don't know. That's going to take some getting used to.
Yeah, that's hard to that's hard to like decide not to do something or to do something, because our instinct is to go help the person.
Right.
But also another thing that we have to be careful with, I was talking to one of my friends that's a paramedic in Connecticut, and, you know, it's obviously not as bad as here, but they're having similar cases. And one of his partners actually just went out Lodi because he got beat up by a family member on scene of a cardiac arrest. So in terms of, like, you know, scene safety, that's another thing to like, you know, it's so many things to look out for at once. You know? And obviously you want to do the best and help the patient, but you also got to help yourself too.
I feel like we've explained in the last week several times to different people, and I feel like I've actually said I'm sorry like so many times to people this last week that I've had to say, like, I'm so sorry, like if this were a few weeks ago, or I'm so sorry, like,
would have been different.
We're in a different situation. I'm so sorry. It's a pandemic. I'm so sorry. This is like a crisis in New York City. Like I feel like I'm constantly apologizing because our hands are tied, like, with certain things. Like, we can't take people to the hospital they want to go. We can't take family members with us. Like, you know what I mean? Like, these are, like, I saw someone at the hospital the other day. It, like, really upset me, and I get it. Like, you have to make a rule that is just like, we can't take any family. That's it. And there was a patient at the hospital who was autistic and nonverbal, and he had no one advocating for him. And, like, he was kind of walking around the hospital. He kept getting out of his bed, and, like, the staff kept trying to help him and, like, you know, put him back in his bed. And I was like, this poor guy can't communicate what he needs, and there's no caretaker here to, like, speak on his behalf. It was so fucked up. Like, I felt really sad about it. And I'm like, I get it. Like, we can't, if we're, like, allowing his family member to come, then we got to allow other family members to come. But at some point, you're like, we're bringing people who have dementia in, people who fucking cannot advocate for themselves. And, like, we're basically putting them on their own in a hospital. Like, it's a really, I feel, like, fucked up from it. You know what I mean? Like, I feel like I don't know how to handle this. Like, I don't think any of us do, because we never have to handle shit like this.
Yeah. You know, what's your pronouncement thing down there? Like, how long do you work people before you pronounce them? And, you know, do you walk in and pronounce them? You know? How do you
Again, that's a situational thing. We can, but obviously they have to meet criteria, you know, cold and stiff, warm environment, et cetera, et cetera. Mainly it's 20 minutes to call them on scene. They have to start in asystole, end in asystole. Their end tidal has to be below 10. And so, and 5 rounds of drugs have been pushed after that. As long as they meet that criteria, we're allowed to call it. But kind of like what was already talked about, there's been times where I know that we're not getting this guy back, and it's 80, 90-year-old guy who's skin and bones, and he's got all sorts of issues. But then the family members on scene are so distraught. I'm like, it's better if we just take them. So,
Yep. That's the toughest thing I think for most of us, because we transport everybody cardiac arrest.
Oh, wow.
Like, to leave them, this is new to all of us.
Gotcha.
So to work it for 20 minutes and leave them, this is all new.
Gotcha. Because there's been plenty of times that I've had to leave people, whether it's call volume or whatever. I don't know, since this is new, I don't know if you guys have your officers, like police officers, with you or not. For us, especially in our area, we get our sheriff's office responding to every cardiac arrest with us at some point to kind of help with.
Yeah.
If we choose to decide, hey, this is just a lost cause as it is, we're gonna go ahead and leave this person here. So we kind of have that kind of buffer sometimes where we can kind of pass it off to them and be like, hey, we're calling it here. We gotta go, type deal.
Yeah.
It doesn't make it any easier, because obviously the family's still there.
Yeah.
Watching as much as they try to not let them in.
That's the scary part, like, because the one arrest, our first arrest we had, like, the family was pretty heated. So
they were very upset.
We kind of like skedaddled out of there, and we're like, we're gonna leave this with you.
I think that arrest actually went as well as it could have, because at that point they weren't assigning BLS, and BLS actually like flagged themselves for the job because they were like a block away. And we also had CFRs, like the firefighters came in, and actually that company was really great. They like all suited up, they came in. And so, I mean, it was like, you could tell the family was like fucking shocked. Like, and again, like this guy looked so healthy. I mean, I was on the phone with like medical control trying to get orders and looking around the house. And I'm like, there's like healthy foods, juicer, like this guy probably took care of himself. And then unfortunately got COVID. And like, you can understand why the family would be so shocked that their dad just died in front of them, And like, I think it was actually really lucky for us, because the BLS crew ended up, because we had the firefighters, they did most of like the actual CPR, and the BLS took really the initiative to talk to the family and to get information. So they kind of developed a rapport over the time that we were there, so that by the time we did call it, I don't think that it was a complete shock anymore. And also, like, they kind of saw the BLS crew as like being on their side. Like it was like, I don't feel like we were met with the kind of resistance that we would have been met with otherwise if we didn't have all those people on the scene. Like, I think everybody did a really good job that day. You know what I mean? Everybody kind of took a role on and like really did it really well. But I think for people, like, it's like their family member suddenly being this ill that they're dying is like a huge shock. Like, we had a DOA the other day. Remember that guy? He was probably my age. Like, he's probably like in his late 30s, early 40s. Oh, yeah. And well, he wasn't the one in arrest. His mom was like 60.
The guy left for an hour.
He left to like maybe go to the store or whatever. And his mom was okay. And he came back and she was dead. Dead, like DOA, like we got there and we're like, whoa, like we didn't do anything for her. We just pronounced her, and he was fucking like hysterical. You know what I mean? He was sitting on the stoop. He, like, when I said, I'm so sorry, like, I'm sorry, he was like, why? Like, why did that happen? Like, he could not wrap his head around, like, how the fuck did my mother die in the time that I left to now? Like, it was for him, like, absolutely.
Yeah, it's so different from having a family member that has like a patient that's older or has a lot of medical issues and they're kind of expecting it, or if it's like an accident or a trauma, it's still shocking, but it's like, okay, you kind of expect it. But how do you explain to somebody like, oh, she was fine 5 minutes ago or whatever, however long you left her, and now she's gone, like. And unfortunately, like, I'm very big on like talking to the family and explaining to them. Like, we had a couple where they were in bed sleeping. They had been married for I don't know how many years, the cutest little couple. And like, I love old people. That's my thing. so like, I really, really love old people. So I take time to like explain everything to them and like just like be with them if they need to be, comforted or whatever. And now it's so hard to do that. So this couple went to bed, and when she woke up a couple hours later, he was gone.
Yeah.
So, it's also the fact that it's been so busy. We can't stay on scene so long.
You gotta
even
back
I wish I could stay here and like comfort her for like, like she was my grandma, but that kind of like, it's kind of like taking the human part out of it. Like,
yes,
that gets to me a lot. Like,
and also you're wearing isolation gear. You have a mask on. No one can hear you.
Yes.
So
yes. That's another thing.
You can't really touch people too much. I usually try to like put my hand on someone's shoulder and like talk to them and like, face to face, like I'm looking at their eyes. And like now I have to almost like shout to be heard. And so like trying to comfort family when you have all this gear on and you can't you have to have distance. It's so sad. Like, I feel like it takes a lot to like leave that scene and you feel like you weren't able to give the other aspect of what we do, which is like this kind of emotional support to people,
Right.
Because the family is, like, they're still there, they're still reeling from this like horrible situation. And unfortunately we can't offer them the support that we would have before,
The other interesting thing is like the one lady we brought out, she was really sick, and then they have like another 2 people in the house. He was kind of sick. That last shot we did the other night, and they have like a baby, and it's just like this isn't gonna stop because like the whole family's sick, And we told him like, yo, close the room, open the window, but if one person's sick in the house, the whole house is
all sick. Yeah.
And like my neighbor had it, and he owns a restaurant. It's like, yo, where did you get this? I don't know.
So with as many calls as you guys are running, what are your decom procedures then, since y'all are, if at all, do you have any? Is it just like,
well, that's a funny question.
Yeah. Lysol shower.
Yep.
Funny you should ask.
I know.
That's the new scent of the day. It's like,
yes.
Yeah,
like Bath and Body Works.
Does that even kill the virus? Like, does that even help?
I don't know.
It makes me
feel better.
Yeah,
spraying my whole body with Lysol.
It smells clean. So it's clean.
Yeah.
Mm-hmm.
But that's, we're basically.
We did the other day was like a Lysol shower, Clorox wipes.
You're
from the
wiping down your equipment with Clorox.
My sleeves on my sweater are turning colors because I bleached the truck so much. Like there's so many stains on my sweater now.
Yeah.
Maria, you're a clean freak. What are you doing? I know Maria
I'm a psycho when it comes to cleaning. I'm like, on a regular day, I'll spend, a good hour just cleaning, out my bus and like organizing it and everything else. Like now it's like even worse. It's like, like Lysol, Clorox, and then the other wipes on top of it so you don't leave that film, that residue.
Oh yeah, that's the other good thing is Windex. Windex for stainless steel, it keeps the streaks off.
Oh, sure. There you go.
But after you've already bleached, because the reality is that I don't think Windex is
going to kill anything.
Yeah.
If you're Greek, you just spray ammonia on it. Remember that from the Greek wedding?
Yeah.
To stop COVID, you just spray it.
But that is a good point. Like our call volume is so high that we really don't have the ability to like go back to the station each and every time that we have a COVID patient and like decon our whole bus. Like we're sort of doing this stuff at the hospital. Like we're kind of wiping everything down, spraying everything down. You're wearing an isolation gown or whatever you're wearing, you take it off, you spray yourself with Lysol, and then you just go about your business. And like the reality is we might be pulling this virus along with us all day into people's homes. Like, I mean, that is what it is.
Neil, you've been in the station. Have you seen more people coming in for BBP lately, or are they staying out? Because like before, the deal. It's like after every call, I'm going out BBP. Are they like?
What are you doing? Are you giving away our secrets? What are you doing?
I can't.
I know.
Everybody knows.
I know.
He doesn't know.
I'm like, there's a chief listening, and they're like, "Oh yeah,
that's what you're doing." Yep. Oh.
That's why you start every sentence with per protocol, and then after that. Yeah.
You guys gotta make me captain real soon. Thank you. I appreciate it. I'm gonna tell you. I'm gonna be honest. You're doing a great job. You're all doing a great job, and like honestly,
let's get the honest answer, because Rush the Bus is honest answers. What are you seeing? Are people staying out longer? are they really, are they doing the right thing now? You know, like not holding.
And this is an honest observation, and this is an observation over, you know, since 2012, since I became a lieutenant. We shine and we really do our best work when the shit is hitting the fan. And the shit is really, really hitting the fan now. I mean, I don't have to tell you that, but like, whenever we have like a situation where there's a snowstorm or any kind of real crisis that's going on in the city, people really tighten up. You know, they know the rules, they know how to act, how they're supposed to do their job. And I've actually seen less BBPs, believe it or not, than a normal day.
Yeah.
And that's because people are just deconning at hospitals. Yeah. I think that people are deconning throughout the day and putting the extra effort in so that, because they know that they're needed. I think the crews, the BLS crews, the ALS crews, they know that they're needed. They know they're going to get hit with a job right away. They know that there's jobs holding, and they're deconning, and as their partners inside, you know, getting, you know, triaging the patient or whatever, the driver of the truck is actually bleaching everything down and, you know, spraying everything and Lysoling and, like, you know, doing what they got to do to try to be, unless it's like some kind of gross decon.
Yep. Where your COVID patient explodes.
Yeah.
Poor Neil, yo, his first night, the COVID patient explodes on him.
I know, he came back wearing like an undershirt.
Yo,
like,
you should have heard him on the radio. He's like all winded and shit. I'm like, yo, it's been that long.
I know.
He comes back with no shirt on. I'm like, yo, what happened?
Wow, Pete, throwing Neil under the bus.
I'm sorry, it was hilarious. I love it.
And that's, I mean, that was kind of it was my fault and not my fault. You know? So like, there's things I can control and there's some things I can't. I mean, I wasn't the one intubating the patient. I mean, maybe it was a difficult intubation, but obviously it went down the esophagus the first time. So
you know,
yeah, there was power going on.
Shower.
Two shots.
But oh, hey, you know, that's how it goes sometimes. You know, that's part of the job. You know, but you know, I think that, you know, you guys are doing a great job, and like, you know, the city and you know, the United States as a whole, you know, without you guys, you know, you know, we would be in a bad situation. Yeah. And like, you guys overall are doing an amazing job, and like, you know, we're all pretty proud of you. And like, I hopefully the civilians all over the country are educated a little bit more about what we do and appreciate us a little bit more. And hopefully we get the recognition and the pay that we deserve across the country, really.
Yeah,
so
for everybody, you know, hopefully everybody gets something out of this, you know?
Yeah.
So, and they appreciate the ambulance.
How are you guys doing in terms of like people that are out at your stations and stuff?
I mean, for us, like, I think so. I was out for 2 weeks, and Pete was out for almost a week. And then we came back, and then like the other crew that comes on at the same time, one half of them is out, and now another half from another crew. I feel like, you know, unfortunately, we're all exposed to this. You know, it is what it is. Like, I think like our crew at the station, every day we're sort of like losing one, and then maybe one's coming back. You know what I mean? Like, so I don't know, Neil, you might know better. It's kind of
like a circle, like a vicious circle.
Yeah.
But I think it's kind of interesting and scary. We had a couple of people out, and so it's like you're saying, it's like, you know, 2 people come back and then another 2 go out. At first nobody was getting tested, right? And we were doing that whole survey online about any symptoms today at the beginning of the tour and at the end of the tour, and now they like gone away from that. And now you're supposed to monitor your own if you have a fever or whatever, and people are like getting tested to see if they're positive, and yes, after a while their symptoms go away, but nobody's getting tested
to see if they're negative time. Yeah, I didn't.
So I was talking to this one kid at my station, and he's a little bit of a princess, to be honest. So I thought he was like exaggerating and throwing a little bit of a hissy fit. But then when I started talking to him, he's like, oh, okay, so-and-so just got back and they picked up overtime with me because my partner's out with the COVID. So he goes, not for nothing, I have 2 family members at home with cancer and they're both on chemo. So what's like, you know, what protection or what, you know, is it even worth it for me to come in and do this? You know, it's like, all of a sudden, like one of the chiefs walked by or whatever and like, oh, you guys are doing an outstanding job and this and that. And I was like, oh, well, why are you here? You know, listen to this.
Don't send the letter. I heard they sent the letter. Why aren't they coming out and saying hi to us?
Well, I mean, Maria, you work in the division, so like you do see the chiefs. Like for us.
Yeah, no, but like they're not even. They haven't been out that much. Like this was like a random person that I was
just kind of grabbed up, you know, like, hey, you're here. Let me tell you something.
Yeah. So I was like, hey, come over here and listen to this. And you know, she's like, oh, I'll bring that concern to the doctors. And I'm like, you know, that doesn't really give us much of a solution to this if you're going to bring a concern to them. This kid still is going to work with this, you know, with this other person that potentially, depending on what you look at, there's studies that say you can have symptoms for up to 90 days even.
Yeah.
So.
And didn't they release something saying that even if you do test positive but are asymptomatic, you're still supposed to come to work? Or
yeah.
That now they're just doing away with like, forget about everything else. It's like if you have a fever and you're fever free for a couple of days, come back. So,
well, that's what happened for me.
Yeah.
I was sick for 13 days. Like I was so sick. And luckily I didn't have a lot of respiratory issues. I had some coughing, sore throat. My ears were like, I couldn't hear, but I had horrible GI distress, like where I lost 7 pounds in a week.
Wow.
And like, I was extremely sick. And then basically they said like, okay, well, you can come back on this day if you haven't had a fever in 3 days. And I hadn't had a fever in like 3 days. But I mean, up until 2 days before I went back to work, I slept like 14 hours a day, like both of those days leading up to my first tour back because I felt so exhausted, so weak, and so tired. And like, I wasn't sure how I was going to survive that first tour. And we did
Adam, he's from Pittsburgh.
Hi, Adam. We did, he's probably looking to get his microphone set up.
Yeah.
But yeah, we did 17 hours our first tour, and I went home and I was like, my throat hurts and I don't feel good. And I was like,
I was doing a full Hispanic.
I think I'm just
like,
tired. I know.
I was like, yo, I got COVID. You know, I had Taco Bell and I'm like, oh shit, I had COVID.
I know.
Yo, everything.
Really. He definitely, every time I talked to Pete during that time when I was off, he's like, I have this migraine. I don't know. I coughed like twice. You know, it's like, okay.
That's what we were doing. Like, you know, Ian, like you'll see that, like people are going to call and they're like, oh, I have this, I have that. And nobody takes time, in New York City at least, nobody takes Tylenol. And they don't realize that they can just take Tylenol and some cough syrup and some Mucinex.
And control that fever.
And control it. But
that's the same here. We get
like
plenty of people. Yeah, they're like, you do know you have OTC meds for this, right?
Yes.
I don't know why you're calling us.
They're all scared.
There's all the Tylenol's gone.
Everyone's too scared.
Really?
Yeah. They're all hoarding it.
The same with the masks, everything up, Tylenol, masks,
whoever bought the toilet paper.
With the toilet paper.
I'm straight up serious. I mean, Julianne was sick. She wanted me to get her Tylenol. I went to 2 different CVS in the area, and they were all sold out.
Can you hear me?
Yeah, I can hear you.
You can hear me now?
Yeah.
All right. Hey guys, sorry I'm late. I'm switching back to night, so I'm all jacked up.
That's okay. But yeah, Neil, was it Anne-Marie who bought me Tylenol from upstate or something?
In New York, they had it. I mean, she was already up there. She was coming down, and I asked her, and she got it, and that's where the Tylenol came from.
Thank God.
Everybody down here is literally hoarding it. I mean, and it's not, you can't really say that it's the people that had it at the time. I mean, this is many weeks ago. These are people that were seriously concerned, and they said, oh, I'm going to like stockpile this Tylenol just in case something happened. And it literally, to the point now, if you go into a CVS, they say that you're only allowed one bottle per person or family.
Yeah, 1 or 2.
So I mean, it's just crazy. You know, saying, hey, listen, you could stay home with some Tylenol.
Yeah.
You know, in the New York City region, it is a little bit easier said than done.
Yeah.
So
you can still go to a bodega. I know the bodega has it.
Yeah, but I mean, some of them do. It depends. Like,
but it's made in China. No.
Everything, yo, our N95s are made in China. I bet you they're all like scented with COVID, and they're just like, we're gonna take them all out.
Peter.
I'm telling you.
No,
everything we're wearing is made in China. The masks, the gowns, everything.
There's a YouTube video where this woman who's actually testing out a lot of those N95s and surgical masks, and she compares them to the ones that are made in the U.S. So there are some that are made in the U.S.
Yeah.
And the comparison shows that the ones made in the U.S. are actually much better seal-wise and I guess particle-wise. The ones in the U.S. are much better than the ones in China, but I'm sure the ones in the U.S. you can't even find anymore. Like the ones that are made in the U.S. Yeah.
I mean, maybe this will bring some business back to the United States after this, because we do kind of like, I don't know, we get stuff from elsewhere. Maybe this will bring stuff back home, But yeah, I don't know. It's the whole like hoarding of things has been. I found that people hoarded we don't have hair nets anymore with isolation kits that we got. So I went on Amazon today to try and buy them, and it was like literally I was just going down a list, and it was like no longer in stock, no longer in stock, no longer in stock. Like there's no hair nets or hair ties, like all those for surgery, like what doctors wear, like who have hair that they tie back. Those are not available. Like there's nothing available.
You have any friends that are lunch ladies? Maybe.
I know. I mean, when we went to Wyckoff Hospital the other day, and we got a few. Like,
I had to do something to get those.
Yeah, I was gonna say it wasn't free, right?
To get those.
Peter, what did you have to do?
I know.
I never take vital signs. Okay, you're getting paid for that.
I thought he was gonna say I never take my clothes off, but
I know.
Not for her.
He's like, I took a nurse on a date, but I mean, but that's the thing. And like, I have them, but I don't have tons of them. They're disposable.
Right.
I mean, and like, it's one thing to wear them on like a regular job, but if you wear them on an arrest and there's going to be particulates and everything, like you throw that out, you're not going to put that back on your head. It'd be like wearing the same gloves or something, and I feel like when we went to the hospital the other day, a lot of the women there, I was like, oh, nice hat. Like they had basically cut some of the isolation gowns and sort of like formed these head things out of them to kind of keep their hair back. But I'm like, even that, I'm like, people are hoarding.
Right, now we're going to be out of gowns. Nice going.
No, but they're sitting on their couch with a freaking mask on and a hairnet.
Yeah. Oh, I saw a guy driving to work the other day. He had a convertible with an N95 on.
Oh my
God. What are you doing, bro? Like, you got the top down with an N95. I'm like, yo,
that's how that works.
Oh my God. Adam, what's in Pittsburgh, man? What do you guys got going over there?
Sorry I'm late, guys. Are you guys all from New York, I imagine?
No, Ian's
from Florida.
Everybody else is
Ian.
Okay,
I got the screen up. This Zoom thing is all new to me, so I'm sorry.
Same here.
I just like switch back from daylight to night, and I'm like sleeping at 7 o'clock at night. I don't know what's going on with me. I'm
all night
people. Messed up.
We're all night people, so we're just getting
if I look like hell, I'm sorry. So that's why. Normally I probably look like hell, but nothing's really going on here that much. It's not really that bad. Is it bad down in Florida, Ian?
I was telling the guys earlier that it's not as bad as New York, not as bad as most people or most places. We're getting a lot of symptomatic people, but we're still waiting for a lot of testing to come back. So yes and no.
Well, I mean, down there, it's probably like, it's God's waiting room with like, the geriatric population. Didn't you guys say, wasn't that you? Who told me that? That was Pete that told me that, God's waiting room, right?
Yeah, it's exactly what it is, pretty much.
Yeah.
When in doubt, blame Pete.
Yeah, I'm always getting thrown. I get all these
See, Julie, I get it from you. Like it automatically goes to Pete now.
Well, listen, you're not wrong. This is how we defer things. Like it's always Pete saying some zany shit. So I have to like sort of like
and then you see Neil shaking his head.
Clean up the mess.
Yeah. I'm not gonna be their lieutenant anymore.
Like what my partner's trying to say is but yeah, my dad lives in Florida, and I keep telling him, I'm like, please stop going out. Please stop going out. Like my dad lives, he's a little further south. He's in Delray Beach.
Oh, okay.
So, so I mean, like it is happening, but I just keep saying, like, please don't go to Publix. Like, send someone to go to Publix. Like he has a home health aide that comes a couple days a week. But my dad likes to go out, and then my dad tells me wacky stuff like, well, I've lived a good life. I'm like, no, we're not there yet, man. Like, come on.
Yeah. So
I feel like it's just really starting to enter into Pittsburgh. Like that's what I've been getting the sit rep emails from now, is like it's just starting to get here, if that makes sense. Like I just dressed out in whatever it is, Tyvek suit and everything for the first time yesterday or the day before for a patient, but we haven't seen nearly, like it's not like you guys. Like our call volume, I was talking to a guy who's he's my best friend. He's down in Fairfax, Virginia, and he says their call volume has gone down too. Like our call volume's gone down. Night turn seems like it's still busy, but daylight is ridiculous with how like slow it is. Knock on wood.
I know, knock on wood.
Yeah, so I don't know if this like social distancing stuff that they're putting into everybody's head is actually working, but I feel like in New York City, I was talking to my best friend again, and I was saying like, man, like it's not bad where I'm at, it's not bad where you're at, but like he's like, yeah, that's because we're not New York City where our population's like ridiculous. Like there's so many people in New York City. It's just like you're ass to elbows with everybody, you know? Like that's crazy.
Yeah.
It's nuts.
Apparently, Newark is just as bad. Newark's getting FEMA help. They're coming in. I thought Dan was gonna come on here. He's in Holy Name in Bergen County, and he said Bergen County is crazy. So it's like just as bad as we have it in the city. So it's crazy. I think it's like everything north of the Driscoll Bridge, is pretty bad. So
well, we're in a densely populated area. People live in apartment buildings. So it's one thing if you live in a house and your house is separated from the neighbors around you and you adhere to that social distancing rule, and maybe you go out to mow your lawn or something. But for New Yorkers, particularly people who have like kids home from school because our schools are closed. Like if you've got 2 or 3 kids in your apartment, you want to get them out into the fresh air. So people are still going out. But what ends up being a problem is that people are going out like as if this is not a thing, like maybe because it hasn't personally affected them yet. Like we worked this weekend and it was beautiful on Sunday, and you drive past any New York City public park and it's like a fucking picnic. You know what I mean? Like people are like, oh, dope, it's spring, like let's hang out. Yep. And it's like, yeah, that's actually supremely dangerous and like asshole-ish, because now you're going to go home, you're going to press the elevator button, you're going to go to your mailbox and touch the mailbox, you're going to touch the railing, and your elderly neighbor who's got a bunch of comorbidities. What's that?
He'll turn into a cat.
Oh, weird.
But got COVID and he turned into a cat.
I mean, like we have these older people and like we keep hearing the same thing over and over. People are like, oh, but they haven't been out of the house. They haven't been out of the house. Like I just, I go and get groceries, but I wear a mask. And it's like, yeah, but everybody, or the gloves that you wear to touch everything in the world.
Julia, I have to tell you that Subway Creatures thing that you saw on the oh my god, it is gold. That is gold. That's
I know.
Gold.
Do you all
do you know about Subway Creatures?
Yeah, that. And then I sent my wife a picture of the one with the dog, the little chihuahua thing with the mask.
The mask.
Yeah. If anybody here doesn't know, if you go on Instagram and you go to Subway Creatures, it is like the most amazing Instagram page.
And it's funny because it's true.
It's funny because it's true. Like these are literal pictures that people have taken of people on the subway, and it is astounding. And this is like, if you live in New York, like You see
Is
this
that kind
all
of
the
like the
time.
people of
Normal to you,
Walmart
yeah.
thing?
Yes, it's like the people of Walmart, except it's
Yeah.
like, you know, the
Yeah, it's all
subways in New
subway
York
people.
Oh,
City.
Subway, yep.
Yeah.
Awesome.
It is. It's wonderful.
Uh,
Highly recommended.
We went to
Done.
New York City, I don't know, like two years ago or something like that, and Marissa knows how to use the subway system and everything. I have no idea how to do that. So that was my first time getting that like whole that experience down to the subway.
Yeah.
And I had always heard about like rats and everything and how big they are. I took a picture of the one. Like it looked like the size of my dog. Like it was huge. It was huge. They're huge.
They are.
Station. You should see the rat I killed.
Yeah.
Yeah. Ask Neil about rats. Neil paid overtime for that.
Yeah, I did.
Yeah.
No,
That rat was no joke.
I'm at that too. I don't give a shit. I said, right out of here. I said, I'll pay somebody overtime to kill this rat.
Yo, that rat, that was a big rat.
It was. It was like the size of a cat, and it had literally no fear. So I think that's the thing too. Rats are like not afraid of humans. So like they just come out like they're not afraid. They don't scatter. Nope. Like they're like 15 pounds heavy.
Jeez.
Yeah.
Yeah. Hold on, let me find it. I'm gonna send you guys a video. This is
the bodega one?
Nah, the one from the kitchen where I whacked that rat with the cane.
Yeah, this is no animal rights people should see this. It's really awful. So
it's
Have you guys been mandated a lot? Or I know you said the first day back, Julie, that you guys
Dwayne knows about the mandation life.
I know.
What do you got? They're holding you?
I mean, I'm happy I'm off tomorrow. If it wasn't for me doing overtime today, I'm sure I would have been mandated today as well.
Yeah.
Like I think as soon as everything happened, I made it. You know, I'm not too much of an overtime whore, but it was like I feel like I have to do overtime just to help out half of the other crews that are and just so that they don't get mandated. You know, if I could voluntarily come in and not upset my wife, then I will do so. Because
I worked last weekend and they held us every single day.
Yeah.
And
wow.
That's 12 hours, and then the first day we got a late job too. So I was there 18 hours, went home.
Oh God.
But now
showered, slept for 2 hours, and had to work the rest of the weekend and do the same thing.
Yeah, but now with this new thing, apparently we're required to get mandated at once a week or so, or once every other week or something like. Or with the 12s, it's once every other week. I don't know how it is with the 8s, but
they're holding all the 8-hour people for 12. And
say that again.
They're holding all the 8-hour people. Everybody who's they're holding them for 4 hours extra.
Well, I think Pete and I, by the end of our week, in the 4 days, we had already covered 60 hours, and in the 5 days, it was like something like 74 hours.
Yeah.
So I was really shot. I mean, I spent yesterday being a bum. Like I literally did nothing. You know what I mean?
Yeah, that first day off is always like just recovery.
Yeah.
Not a real day off.
Yeah.
Ian, how many jobs do you do on a regular day? Because you guys do 24s, right?
Yeah, we do 24s. So I'm at a pretty big house. We have 2 suppression units and 2 rescues, which are our ambulances. So we're one and the same. So fire department does our transports as well. We're all cross trained, et cetera, et cetera. Right. So, but our rescue will run 12 to 18 transports a shift in a 24-hour period. I've been on it before and run in the 20s before on random days. Yeah. And both of our suppression units have been known to run high 20s, low 30s before.
And that's pre-COVID? That's before?
Yeah, pre-COVID, yes, sir. Yeah.
Wow.
Yeah. They've actually cut that back. Our call volume for the suppressions have gone down because they won't send the suppression units on anything unless it's confirmed, like cardiac arrest or something like that.
Yeah.
So has the rescue call volume gone up because of that, or?
I want to say it kind of evens out because their calls take longer now because it's just the 2 of them, you know, as opposed to the 6 or whatever. But so their calls are taking longer, and a part of our new decom procedure is, again, if any patient has so much as a cough or a fever, After you finish deconning yourself, a captain comes out, and we have a little mister thing called an aeroclave that he hooks up, and it basically mists the whole rescue.
Was that
out.
bug fogger looking thing?
Yeah, like a bug.
Yeah, we have one of those at my station now. So.
Nice. Yeah, so
cool.
after every COVID call or suspected, alert call, he has to come out and mist the entire rescue.
He's doing
wow.
And I don't mean to take too much time.
Captains are getting hammered.
What's the details of your so this decon happens just for COVID calls or just in general, like after?
Yeah, our new protocol is just for the suspected COVID calls. So my department's gone extremely broad with, we're not getting, as far as I know, we're not getting a lot of confirmed COVID cases right now, which is why I'm thinking we're gonna get caught up with it within the next week or so. So we're just running a lot of people with symptoms. So basically my department said if anyone has a fever or a cough, just by itself, you treat it like it's a COVID patient. And so that automatically right there means a captain call out, and he'll meet us at the hospital for that.
What's the decon process for that? Like, you said it takes a while, so I'm assuming it's a lot of different, steps and processes that take place.
It's actually not bad. It's actually just like a 2-button system to hook in, but it's about, I think they said it's a 10-minute mist, and then you have to let it sit for 20 minutes, and then you have to let it go out for like 10 minutes. So.
And is this still while you're suited up, or just in your regular uniform?
No, this is once everyone, both crew members decon. This is after you wipe everything down with the Clorox bleach. This is after the initial decon. Then the captain, while you're stripping down out of your PPE and stuff, the captain hooks this up, and then it's an extra 20-25 minutes after that.
Wow. Yeah, we're out of service for like 3 hours total.
What?
Yeah.
We get
3 hours?
What?
From start to finish, from like start of the call to like getting back in service.
Wow.
That's a lot.
They call it, I don't know what they call yours, but it's called a sniper unit for us. It's like it looks like a big power wash system, and they go in. They spray
Get the hell out of here.
Wow.
Yeah, they spray they spray all the things, and you have to wait till it dries, and you Clorox and bleach and everything.
I feel like, and I'm not saying like this is 100% going to change for you guys, but I do feel like as this moves further west and further south, like you guys might have to challenge. It might change because the reality is, like we're like even our RMAs, we're going into people's homes who are positive for COVID.
Yep.
Basically are calling us because they're like, I just feel really weak. I don't feel good. And they're like,
and you have to go out BVP after an RMA, right?
Yeah, that's it. Like we literally were like, okay, do you want to go to the hospital? Because you probably shouldn't. You should probably stay here. Yeah. And then we like maybe take their vitals, and then we go back in our truck and just like go available.
Yeah.
That's it.
Yeah, we don't have like a decon process. Our decon process is whatever the crew themselves feel is necessary. So us wiping it down, us, if we want to spray Lysol on ourselves, we can't there's no supervisors trying to help us out. There's no decon process, no anything.
No out of service time. Really, like that's
literally rushing us to get back. Again, I understand because the call volume is so high, but after 20 minutes, 25 minutes, 30 minutes or so, they're calling us saying, please go available.
Normally that would be with us too. 20 minutes, you get dispatched bugging you.
Yeah. That's the thing. I think we're going to see a lot of change because, there's a lot of people with these crazy, I don't want to say crazy, but they are crazy to us, like these decon procedures. And when it gets that busy, I just wonder, I think they're going to fall to the wayside. And it's like, what is the minimum of the best to clean your truck? Like you can't scrub every single
I know.
That's
why
I don't even think they put best in that conversation.
I know. I think that's that was the thing. Like at the beginning of our week, I told our lieutenant like I need some wipes. He gave me Clorox wipes. They were gone like 4 days later. I brought my own Lysol. We had some Lysol, but I brought my own Lysol to I left our ambulance soaking wet for the next crew. Like the other day, I was like, give it 20 minutes. Everything's wet. I'm sorry. Because I sprayed everything down because the seats, the steering wheel, like the seat belts that we use, everything I coated with Lysol.
at the end of every tour, I find myself just leaving half of the cords hanging on the ceiling bar just to dry off.
Just to dry off.
Right.
Yeah.
So do you guys wear anything other than masks in these houses?
It depends on the call.
Yeah, we got gowns.
Do you have any other PPE though? I mean,
so technically, no, we don't. The protocol for us is literally just an N95, and I think that you have the option of putting a surgical mask on top of the N95. Yeah. But that's us. But a lot of us, we provide our own stuff. Like we try to get our own masks and things like that because we just don't feel comfortable with just. Well, for me personally, I just don't feel comfortable with.
Feel better, Dwayne?
The N95 is like, now it's like they're running low, so you're only supposed to wear it if you have a cardiac arrest or you're using CPAP, and they're taking CAD numbers to see on what jobs you did.
Yeah.
So it's like a 1-for-1 swap.
1-for-1.
Yeah.
Yes.
Like even a gown, like you have to provide a CAD number to get another gown.
Yeah.
And so we're going out with like 4. And I was talking, to my kid's mom. They start their shift with 10 gowns. So
wow.
Work
10
and
gowns. Wow.
Meanwhile, we're like we put the gown on to a call that comes in as like something like a DOA. We gown up.
Like,
then you go
we
in.
didn't really touch him, so we're gonna.
Yeah, that's it. I'm like, oh, the person's dead already. Okay, I'll just get some paperwork ready, and I'll take my gown off and hang it over the thing so I can wear it on the next call because like.
Oh, that's not happening, Julie. You're much better than me. I'm definitely throwing that out.
I can't do that either.
But that's we stage our gowns too. Like when we start the day, like we open them up and we stuff them in the net. So like, I feel bad. When you pull up, you gotta put this gown on and the gloves.
Yeah, it takes forever.
Yeah, people are waiting for us to get into.
They're looking at
That's
you.
how it is with us too in these cases. Yeah. Like if I don't know if your dispatchers asking like screening questions before you get there.
Yeah.
They ask too many questions.
Yeah, if ours come up like that, it meets criteria that and it's not like a high acuity call, we can gown up before we go in there.
Yeah.
And that's like a culture change because you have to get dressed a little bit and then you have to go in kind of thing. It's not like just walking in like we usually do kind of.
So then I had another lieutenant tell me the other day that I shouldn't gown up until it's confirmed that it's an arrest.
No thanks.
So
and by then it's too late.
And that's what I told him. I was like, I don't understand how that works. Am I supposed to walk in without the gown first, see it's an arrest, walk out, and then gown up? Like,
right, yeah. Wait 1 second.
I said, I don't care how many gowns you waste in your box at the desk, but I'm gowning up before I even go in there. It's definitely not happening.
We have in our house bags, we have gowns, eye protection, and N95s in the top sleeve. So if we get into a critical call where we do need to gown up, then we can just grab them out of the thing and gown up there.
What are you guys doing for eye protection? Because our lieutenant supposedly asked us if we have those goggles that we got like when we became EMTs, and I'm like, hi, I have no idea where that thing went. I'm like, I don't have one of those. So I had a pair of glasses or whatever. And they're like, oh no, you're not allowed to wear those. You gotta wear the goggles. I'm like, okay.
Yeah, but they don't even give us goggles, do they?
No,
I never got
one. That was a long time ago.
Well, when you got your EMT bag back in the day.
Mine's in the bottom of my tech.
That's like 14 years ago.
Exactly.
I don't even know what that is.
And even like our PPE gear, I had the flip down visor. So when I came back from childcare leave, I was like, oh, everybody has these cool goggles. And they were like, yeah, you got to go up to quartermaster. And I'm like, yeah, I don't have time to do that, So like I just had the visor and I still don't have goggles. I'm like, I might try to order some on
But I think it's
Amazon to go over these, but
yeah, I think it's just just us, the fire department, like because I work for the voluntary also outside for Maimonides, and they give us goggles every shift. So they give us the N95 goggles. But it's weird. They only give you one for the day. So even if, I use it for I use it for my first call as a COVID patient, again, I'm not using that N95 again. So it's sort of, but the goggles I can definitely disinfect those and then put those back on and everything else.
Do you get one N95 for the day? Because I know like the privates are getting like one thing. You know,
I mean, I haven't worked there in about 3 or 4 weeks, so maybe it's changed. But the last time I worked, they gave me that one for that shift, and that was it. Like I couldn't get another one. Yeah.
There's a county around here, the county I actually live in right now. I was told their fire departments are getting one N95 per truck, and then they have to reuse them.
But they gotta share it too. Like here, brother.
Like, you signed up, rock paper scissors. We're sorry, rookie. Here you go.
Here,
Oh my god.
Oh my God.
Wow.
Yeah, that's awful.
Yo, the
That's
law
awful.
gonna come out of this thing.
Oh my gosh.
Yeah.
Crazy.
Not just us, but like the hospitals, like New York City itself. I mean, it's unfortunately people are going to be very upset. Like, God forbid. I mean, like there's people. I heard a story at one of the hospitals the other day. They're saying one of the nurses who worked at this hospital, her husband he works like with nursing homes, but basically he's a manager.
Yeah.
He doesn't go and deal with patients in any way, shape, or form. His wife works at the hospital, and he got COVID and he died.
Yeah.
Like she found him in cardiac arrest, and I'm like, so she's.
Oh wait. So the worst part about this whole story is the body stayed on the floor for a day.
Mm-hmm.
That's the other thing. You guys don't.
At home?
We didn't.
At her home.
At her home. Yeah. So the thing is right now, the ME is 24 to 48 hours behind coming to pick up bodies.
Yeah.
So does that mean PD is waiting on the body for about?
No, they were for
pictures. They're taking a picture, and I guess they're sending.
Yeah, and then they leave.
Number.
Yeah.
And yeah.
Because that was the thing.
They leave the body there.
Oh yeah.
Yep.
Bro, like
there.
there's nobody to pick up these bodies.
And the really sad thing is, I mean, let's face it. Like, if this is a COVID patient, like once that point comes where your sphincters relax, like you're just releasing all your inside juices onto your bed, like now your family has to sort of deal with this like hazmat situation, basically. I mean, it would be a hazmat situation anyway, but like now you have these civilians who are dealing with their loved one that's dead. They have to leave their loved one, like close the door, let them be in there for 24 hours. And all that shit is like leaking out into
or they're on the living room floor.
Or in their bedroom or wherever,
So this was, I mean, Ian and Adam, I don't know if you guys know, but for us, whenever we pronounce somebody and let's say it is in a home, we have to sort of, an EMS crew has to stay with that body until PD shows up. And then I guess in the past, what used to happen, PD used to stay there until ME showed up. So I bring that up. Yeah. So I bring that up to say that today we actually had a patient, and again, we waited on PD for about 3 hours on this body for PD to show up. Now during the process of that 3 hours, again, same thing that Julie had said. The lady had defecated all over her bed, the floor, everything was all over the place. So we were working around shit, literally working around shit the whole time. So when we pronounced, we stayed with the body. The family was very, I guess it was part of their religion. They were very, very adamant about cleaning up the body. They wanted to clean it up and make sure that, she went in a clean way. You know what I mean? Technically, we're not allowed to allow them to mess with the body until PD gets there. Again, after like an hour or so, they kept hounding us. Can we clean up the body? Can we clean up the body? 2 hours went by. I told them we're just going to step outside the door and listen, whatever happens once we step out the door is whatever happens. But we couldn't deny them that after 3 hours. You know what I mean? Like that was a tough scenario too, especially being there for 3 hours and they wanting to clean up the body.
That's awful. You know what I mean? Like it's even awful waiting like a half hour.
Yeah, 3 hours we were on that body.
That's crazy, bro.
So like, what are me, Pete, and Julie were talking about it last night before I went to bed. You guys were saying CPAP. I don't know what you guys talked about too, so I'm sorry that I'm late to all this.
No, that's
I'm just
okay.
curious. What is everybody presenting like these patients?
All right, so go ahead.
I'm interested because that's something that I'm not like familiar with right now because we're just getting into like seeing them for the first time. What are they all presenting with?
Bizarro symptoms.
Yeah, it's like they're clear, really low pulse ox, high heart rate.
I'll be right back. I have to get my charger and a drink.
Sure. Yeah, so it's like
Adam,
low pulse ox, and they're normal.
Like they're warm, they're mentating normally, they're talking to you, they're alert and oriented, and then you start taking their vitals and you put them on the pulse ox and it starts blasting that alarm and you look and they're sitting at like 64. and you're like, what the fudge? Or even lower. And they're totally mentating.
I'm going to hit this button and see what happens when we go live on Facebook. Let's see what happens. No?
No? We don't want to go live.
Yeah, why not?
And we have to censor. Then we have to censor. No.
That's true.
It's recording anyway, so it doesn't,
But it is weird, and I feel like one of the things that we're seeing is that for a lot of these patients, particularly like older patients, they're at home with their loved ones for like a week doing okay, like they feel crappy, but like they just have a fever and they go for like 5 days, 8 days, 10 days, and their family thinks like, well, surely they're going to get better soon, right? It's been 10 days. And then on day 11, they're fucking calling us because their loved one's about to go into respiratory arrest.
Yeah.
Like they're tachypnic, like 40 breaths a minute. They're freaking purple. They're cyanotic, like you've never, like cyanosis where you're like, that guy's blue. Like you can see it from the doorway. Like their face is blue. Their hands are blue.
Yeah.
And then you're like trying to deal with that. And they're actually saying that like
they're still conscious though.
But yes, they're still
not
conscious.
Like it's not like a hypoxic rage.
No, but I've been reading
normal conscious, like everything seems normal. Yeah.
Yeah, they're just like, help me, I can't breathe, I can't breathe.
Yeah.
And by that point, like they're not probably gonna have a positive outcome, unfortunately. Like
So
they go to the hospital, and that's kind of it,
The interesting thing that I heard you guys say last night is that if you CPAP them, it's making them worse.
Yeah, I don't know what that's.
Yeah.
I don't know why.
I don't know why.
What do you do? Like, what do you guys do? Like, how can you help them?
The hospitals are just tubing them. That's it. And for us, because our protocol is like we have to call for sedation. It's sometimes not worth it.
Deep down, like thinking further into it, if CPAP doesn't work, then tubing isn't really going to work either. Like it's still.
I saw a link somewhere for like another study, and they were talking about how actually tubing them is making it worse and like killing them.
Really?
So yeah, that was another theory.
Maybe it's just the CPR that's being done, but I've seen the capnography drop drastically fast after tubing somebody too. In a cardiac arrest as well. Yeah.
But that's why they're saying like they're having these studies in the hospital that for a lot of these patients they're proning them because they have more surface area of the lungs to oxygenate, and because when you lie someone supine, basically all that fluid gravitates towards their airway and all this other shit, like anything in their stomachs or anything in their lungs, it just kind of spreads out. When you lie them prone, that doesn't really happen. They kind of put them in like a reverse Trendelenburg, like not, they're not in like a semi-Fowler's, like you're literally putting them in a reverse Trendelenburg. So they're kind of on an angle so that all the fluid stays low. And because they're on their chest, obviously chest rise.
Because remember, we had those people, they're like super short of breath and they just want to lay flat. Which is completely different.
Really?
Yeah.
Yes,
so like we had a bunch of people like we're laying them flat.
You always want to sit them up right away, right?
Yeah. But they feel like better when they're laying down. And then once we sit them up and we start moving them, like holy crap, they like decompensate like really badly. And that poor guy the other day, we had to carry him down like 3 flights of stairs. And
it's funny.
Like,
it's funny you say that.
Trying to reach out and.
Yeah, it's funny you say that. The last cardiac arrest that we had today, the daughter was saying that she was feeding her mother. And she was laying down, but she told her to sit up while I continued to feed her. And as soon as she sat up, she went into respiratory arrest and then cardiac arrest right away. So it was, I wouldn't have put 2 and 2 together until having this conversation.
It's really, I guess because it's not just this like fluid overload. I guess like all the cytokines are kind of like attacking the lungs and causing all this fluid backup, but like the tissue is degrading or something too. So there's like all this shit like in the lungs. And I think when they're lying flat, maybe there's more surface area covered, I guess, or like it's not as bad. Whereas if they sit up now, they're like almost full of this shit. You know what I mean? Like,
so it seems like we have no defense even for the underlying aspect. Even if, someone has COVID, granted, we thought that we can still fix some of the issues that were presented because of COVID, but now it seems like that's not even the case anymore.
Marie, your dog's adorable.
Oh, thank you. She wants to be in on this Zoom meeting.
Mine's butthole right there.
That's your giant dog.
Yeah.
I mean,
I think the only way, like, because it's constantly evolving, and this is the only way, if everybody talks with each other, that we're gonna learn, what to do and like what to see, because I remember when Julie had the GI issues, everybody's like, you don't have COVID because you're having GI issues, and now
which is now a screening question for us.
Everybody has GI issues.
And I knew, I was like, the first day I was like, all right, maybe I have like a norovirus. Like maybe I got a stomach bug. And by like 6 days where I was so dehydrated, I couldn't sit up straight. Yeah. Like I literally, and it was for me too, I had to lie down. Like the minute I sat up, I got extremely dizzy and I had like a high fever. And so I needed to lie flat, either supine or just like kind of in a semi-Fowler's position to even be like remotely comfortable. And it was funny because I ended up, I called an ambulance. Like I called our lieutenant, because at the time I didn't realize how bad the hospitals were.
It was
and
bad, bro.
I was like, I'm alone. You know what I mean? Like my ex-husband and I are separated.
Want me to stop recording for this half of the story?
No, it's okay. But I'm
not all ambulances are created equal. I'll tell you that.
I know. Well, I mean, not for nothing. Like they should learn to like be actual good EMTs. I mean, not for nothing. But anyway, I basically laying in my house, sick as a dog. Like I felt so bad. By like day 8 of me being horribly ill, I basically called my lieutenant. I was like, I can't function. Like I think I need fluids. Like I think I need like, potassium, electrolytes. I was starting to get leg cramps and my heartbeat was like starting to do weird things. And I have a history of AFib. So I was like, I need help. I think I need help. I can't take care of myself. Like I need help. And so I called our desk lieutenant, and it wasn't Neil, it was someone else. And instead of sending one of our units, because I don't live that far from the station, they just basically put it into the 911 system, and a BLS crew that I was totally unfamiliar with came to me. And the first thing I live on a 4th-story walk up. I didn't want them to have to come up here and deal with me. So I started walking down, and I met them on the 2nd story, and they weren't masked up. And I said, you should put your masks on. And they were like, what do you mean? I was like, your masks. I probably have COVID. And right off the bat, the EMT goes, you probably don't have COVID.
No, do the voice. Do the voice.
He was Eastern European. He was like, no, you don't have COVID. These are not symptoms of COVID. And
so much better.
I was like, thanks, doc. Because now I'm annoyed because I'm like,
well, not for nothing. In his country, he's probably a doctor.
I know. But I was like, I didn't want to be but I'm like, as a medic, if I called you to come on my scene to help me with a patient, are you gonna fucking question me then? Like I'm asking.
Did they know you were on the job and stuff?
Yeah, like they know. Like
it said MOS.
It said MOS in the text, and I said I was like, I work at station, whatever, and they were like, the one guy's like, where's that? You work for Wyckoff Hospital? I was like, no, I work for you. Like I was so annoyed by it. And I got in the back of the truck, and they're taking my vitals with a rad 57. Like they're not touching my pulses. They're not doing anything. And I was so irritated. I was glad I had a mask on because my face was like, I'm pissed. And
that's another good thing about these masks, is you can hide it. When they call and there's like a fever, it's like, why don't you take time? Or your face's disdain can be.
I know. And I was trying to be, I honestly felt like, look, I'm just going to ask them to take me to the closest hospital, which is Wyckoff. Like, just take me there, and that's fine.
You're going to do like a Silverman? Just transport.
Yeah, just transport. Like, seriously, just transport me. And a boss showed up, and it was a boss from Queens. And right away, she also was like, ma'am, they're not going to do anything for you. This is a virus. There's no cure. I'm like, no shit. Like, I know. I was like, I'm a paramedic and I need fluids. I was like, because at this point, I'm not making urine, so I need fluids. And she was like, oh, okay, well, they'll probably just give you fluids and send you home. And I was like, well, that's fine. Like, I was just like, just fucking take me to the hospital. And she was like, well, you probably don't even have COVID if you're saying you're having diarrhea. I was like, actually, if you read some of the information, I was like, that's a symptom. And
that's one of the signs,
she rolled her eyes, and I was like, you know what? Fuck this. And I like got up, I opened the door. I was like, you know what? I'll fucking call a crew from Brooklyn because they fucking know what's up. I'm getting out of here. And I like left the ambulance, and they were like, ma'am. And I was like, and I like walked in my house. They called my lieutenant.
Didn't Victor come get you?
yes, like the next afternoon or whatever. But like, I called my lieutenant and they were like, yeah, they're waiting outside for you. They said there was a miscommunication, and I was like, you can tell them to fuck off. Like, get out of here. Like,
no miscommunication there.
I was so upset. I'm like, yo, I'm not some asshole off the street. I'm a paramedic. Like, I work for you guys. I'm telling you, I haven't had any urine output. That's a big deal. So how about you
That's
just
not a big deal? Come on.
How about you just take me to the hospital? You
They're
know
just
what I
gonna
mean?
send you home.
I know. I was shocked, but yeah. So that was my bad experience with my own ambulance situation.
The orange body bags. We heard they're orange body bags too. So.
What, in our bus?
No, the body bags are orange.
Oh well, some of them are.
To differentiate.
Yeah, that's what we're told.
Yeah.
They're different colors.
Like
so.
they're hazmat.
Yeah. The one hospital last week they had one trailer, and now they have 2 trailers.
Well, actually, their second trailer.
Every hospital.
Yeah.
And I went to Bellevue the other day because everybody's transporting to the closest, obviously. But I had a trauma, so I went to Bellevue, and usually that place is like Woodhall times 3. You know, like with the loony bins, and everybody's sick, and it's crazy there. I walked into the general area. Every single bed was taken, and every single patient was on a ventilator.
Oh shit!
It was so eerie. It was so eerie, to go in there.
Yeah,
and then
Woodhall had like
driving
15 vents in the
driving out, the trucks, the morgue trucks are just lined up. There was 8 trucks. Freaking crazy.
Wow.
Yeah. That's at the
pouring them in these trailers. Are they just putting them on each other, or
Yes.
I haven't.
Oh, they're in the bag, and then they just throw them in. Yeah.
They don't have any space in their morgues. I mean, one of the hospitals we went to the other day said they had filled up their second trailer, and they had bodies upstairs that were waiting for hours to be taken down because they literally had nowhere to put them.
Yeah.
It's that bad there.
It is that bad.
Today I saw an article that said that there's that they might start. I don't know if it's true.
I don't know if that's true. Yeah, in
the parks. Yeah.
I know.
I was
I don't know.
That's a little.
Just put it this way, again, I don't know how many units we have throughout the city itself, but in Brooklyn alone, at Station 57, each unit is doing 3, 4, 5 cardiac arrests a day per unit.
Yep.
Plus the DOAs that were just pronouncing.
Don't even count.
So
right. That's the other thing.
3 to 5.
That's the other thing they were saying, and the people that are left at home that were pronouncing whatever, they're not even counting them.
Yeah, they're not counting them as COVID.
They're only counting the ones in the hospital. Yeah,
because
the body count is real. I'll attest to it. When this thing first came out, I thought it was bullshit. It's just another flu. Don't worry about it. It's
first
nothing.
thing I said.
But as soon as those bodies started coming up, I was scared myself. I took the Lysol shower several times.
Yeah.
Yeah. Yep.
That's it. I mean, because it's been this point where so when I was sick, I didn't see my son. He stayed with his dad. And so right after I felt better, I went and I saw him, and I hung out there for 2 hours or whatever. And then when I got back to work and I started seeing the reality of what this is, and then I read a few things that said there is a possibility of contracting it again and being reinfected, I'm not seeing my kid anymore. I'm seeing him through FaceTime. Because the reality is, I don't want to bring that not only to him, but to his dad, because, God forbid something to happen to his dad, who's going to watch my kid. I have to be at work, you know what I mean? And so it's we're really at a point where, that's it. I feel it sucks, not seeing my son, but at the same time, I'm not going to take a chance that I expose him to this, I didn't think it was this bad, and now that I know it's this bad,
we saw the
it's
picture.
kind of scaring me,
on our Instagram, we had that one picture, and they apparently the line was down and around the corner that night. And we went there. Yeah, our first night back, we waited for 90 minutes, and we didn't even see the triage nurse. And the postictal person, he became non-postictal, and we're there's no beds. Call your mom.
Yeah, we
called his mom.
He was a young guy, and his mom was, probably in her 50s, 60s, and we basically were if you feel better, you probably shouldn't wait here. And he was yeah, I don't want to get sick. And we were then call your mom and have her come and get you, because the reality is you're going to wait here all night, and you're going to be exposed to all of this, there's nowhere to put you. I mean, there was a guy in the waiting area that we were in who fell on me. I was standing and I felt someone like bump into me, like from behind me. And I thought it was like an oxygen tank. Like I thought it was one of the big tanks. And I turned around and there's a guy on the floor, and we all kind of pick him up and put him back on a chair. And as we put him on the chair, I can see he's completely cyanotic. But I told the triage nurse, like, whoa, like this guy's cyanotic. It took like almost 10 minutes to get an oxygen tank to him because they couldn't find any. And then it took like another maybe 10, 20 minutes for a doctor to come and check him with a pulse ox. And then that doctor like literally ran off trying to find a bed to put this guy, because they probably realized he's probably gonna be in respiratory arrest in a few minutes. And he's sitting not even in the waiting area, he's like in a vestibule. Like he's practically at the front door of the hospital.
Yeah.
So like
Is that at Wyckoff or?
that was at Brookdale.
Oh, Brookdale?
Yeah.
Brookdale's the worst though.
Brookdale,
I know.
What are you doing by Brookdale?
I wouldn't even go. Yo,
We've been everywhere.
we went from deep in Bushwick, basically to JFK Hospital. JFK.
Yes, we got a trauma. We were on Myrtle
Mhm.
Avenue in Bushwick, and we got a trauma by Sunrise Highway.
Yeah, I think it was like.
Holy shit.
Yeah.
I know.
That's
Like
kudos
that.
to you guys.
I mean, for you guys who are not in New York, that's like normally with traffic, that's like a 40-minute ride at least,
Yeah.
even with lights and sirens on.
Yep.
And it took us like less than 20 minutes.
Yeah,
Took us,
then in 15 minutes.
I don't know, 15 minutes to get there because there's no traffic.
Who was driving, Pete?
Yeah.
Pete was driving.
Yeah.
Crazy.
Psycho, speed
It was-
racer.
I know. But that's
If
how
you
it
can
is.
stop
Like,
at lights, there's nobody out at night. You can
We've
really
been-
stop at lights.
we've
But
been
that's-
everywhere. So
Yeah.
we've actually been to a lot of different hospitals because the
Yeah.
reality is like there's so many people out sick that we're covering basically all of New York. They told us that
They said Ken Will was over in. was-
10 Will was in like almost like Long Island,
Yeah.
like a Manhattan unit,
Yeah.
got all the way out to like the border of Nassau and Queens.
Yep.
10 Will, the city unit, Manhattan.
Yep.
Unit.
Yep.
Nice.
I know. Yeah.
Yeah. So
That's broken.
I don't know what you.
That's
I don't know what
broken
Pittsburgh,
ankles.
and down in Florida, you guys would be going on some rides. So
Yeah.
I don't know if you guys do like mutual aid out of the area, but
I mean, we do, but we're kind of blessed to where we have either a hospital or a standalone ER within 5-10 minutes.
yeah.
Really?
Who does the mutual aid if like you need mutual aid? You know, do you guys?
A lot of our mutual aids within our own county, honestly,
Okay.
as far as transports go, because like a lot of most of our fire departments do their own transport.
Okay.
Yeah.
Where are you at again, Ian?
I'm in Orange County, Florida, in Orlando.
Oh, okay.
Yeah.
Mhm.
So it's nice. We have our big hospitals, and my station is located like right next to a major highway, so it's 10 minutes either way. And then they're popping up standalone ERs all over the place.
Oh wow.
Yeah.
Oh. That's gonna be interesting.
So you guys, like if someone calls 911, you transport to any 911 receiving hospital, or is it any facility? Are the hospitals separated in that sense, or?
Yeah. Yeah, technically we're supposed to transport them wherever, as long as they don't meet like stroke or trauma criteria, sepsis criteria, or whatever. We're supposed to transport them wherever they request. However, the captain's gone, right? So we can speak
Yeah,
up
no,
the protocol.
We
But
don't-
no,
yeah.
yeah, no, he seemed really cool. But you can usually talk them into going to a closer hospital, or just using logic, being like, hey, this one's usually busy, you can go here.
Yeah.
The standalone ERs obviously aren't full-fledged hospitals, so like anything outside of I threw up once or I scraped my knee, they usually don't like receiving, and
Yeah.
we're not supposed to take cardiac arrest or OB patients to the standalones. But our protocol is you take them where they want to go if they are that adamant about. If you can't, talk them into going
Do
somewhere.
you have a distant restraint or like a time frame
That's my
restraint? Like if
question.
it goes above a certain time to transport them to that area, you can't do it, or?
I'm sure we do. I know that there's been a couple random requests for like out on the coast or up in like Jacksonville, and for that you have to get like our assistant chief's approval to transport there. But like as far as it's like within our county, we're a huge county. It'll take probably about, well, I say huge, it takes about 45 minutes depending on traffic to an hour to get across the county. And as long as it's within that county, you you're allowed to take them.
You're good.
Wow.
Okay.
And then do you come up for jobs in that area, or you go back to your first due?
They recently changed it within that last year. Up till last year, we had like our first dues, and we still kind of do. But then they introduced this new AVL system. So as soon as you become available, it pings you, and if you're closer, you're closer. So we've had units get stuck on the completely opposite side of the county, running calls.
Relocating.
Yeah, exactly.
Fun though, you know, you're like, you know, and then you can play naive. You're like, I don't know.
Yeah, that's when you just kind of a little bit. Be like, yeah, we offloaded like 10 minutes ago as you're on your way home. Yeah.
Mm-hmm. Yep. Mm-hmm. Yeah, we still don't do that. Like we have GPS, but there's no rhyme or reason how, like we're passing each other. Like you'll see like a unit from your station and they're going the opposite way, and you're like, yo, I just came from there, and they're going to a job. There's no.
There is rhyme and reason, but it's just bullshit. That's
we can't figure it out.
No, there's rhyme. There's no reason. Okay.
Yeah, okay, I get that. Because you guys realize like we're on the PD GPS, not FDNY PD GPS.
Right.
Interesting.
So it's whatever, however PD operates in their sense. That's how we operate.
Speaking of which, are you still getting PD on your jobs?
I mean,
wait outside.
Waited 3 hours for PD today, but generally yes.
Yeah, there's
no. I mean for like just regular, not cardiac arrest.
No, they're doing the wave from a distance.
Yeah, basically.
Are you guys okay? Type thing.
Yep. So a nice wave 55. We're good. We're good.
Yeah.
What about for? Well, I don't know if like your BLS have like transported like the EDPs. There's certain ones that like the cops didn't want to ride with them. Like do
Funny enough, I don't even hear EDPs on the radio anymore. I don't even hear them anymore. I think they're so backlogged that there's just.
Or they all got
don't
COVID.
come up anymore. However, I do.
They all got COVID, and they're just coming up as COVID.
They're just coming up as COVID.
Yeah, they're all thinning the herd.
Aid, like 2 or 3 of the ambulances stopped at our station the other day, and they were telling us stories about EDPs. So maybe they're giving all the EDPs to the mutual aids. I don't know.
I don't think they're ready for it.
That's a good way to like get them to go home real quick.
The questions that they were asking me, they're not ready for it. No.
Yeah, no.
So our EDPs are second to none.
Yeah.
So yep. Mm-hmm. And we throw.
What about have you guys had any jumpers?
No, actually.
We've been getting a lot of those because everybody like people that are quarantined or people that like they're staying inside.
Staying home with their wife, so they just jump off the ledge. I got you.
Yeah, that too. That would make you jump, right?
You got more high buildings than
Oh, serious?
Really?
Yeah. In the city, you do. Yeah. So like, there was one, for example, that was he left a note and everything. He's like, I can't do this. Like I'm not working. Everybody's dying. Things are going to hell. So 16 flights.
Wow.
And he landed on his feet. Oh.
On his feet, Jesus. That was yours? Jeez. Yeah, that's why I didn't. We got like 4 stories. You got like the hipster that locked himself out, and then they're going to climb the downspout and then fall off in the courtyard.
The hipster.
I'm like, Missouri, I'm going to climb this tree to get in. Fire escape, and then they fall off, and they're drunk.
I've had a hipster that did that actually.
Right? Yeah. Yep. So like we have like a lot of hipsters, and they're from like the Midwest, and they want to take like selfies on like water towers. And then intoxicated, and it's a long way down.
Yeah, it's called deadly selfies.
Mm-hmm. Yeah.
The hipster I had, it's funny. He was drunk. He was at a house party in one of them apartments in Williamsburg. So he was on like the 5th floor or something like that. So he went out.
Or it was in a loft.
I don't even think I went inside. I don't even know. But he was on the he went on the fire escape to smoke on the fire escape. And he locked himself out. So he was stuck on the fire escape. He thought, again, drunk, high, whatever drugs he was doing. So he thought it'd be a good idea to jump down to the next fire escape and try and get his way in from that fire escape. So he jumps down, misses the next floor, gets to the 2 floors down, but in the same process, his hand caught on the floor.
Oh, nice.
Escape right above him. and ripped off his whole, like he degloved his whole hand.
Degloved? Oh my God.
And so we get there and he was like, "Oh, I'm good." And he's got it wrapped in his shirt. Like he took his shirt off.
I don't have insurance. Don't take me to the hospital.
He was like, "I'm good. Don't worry about it. You guys are good." I don't know why they called you. I don't know why they called you.
Oh my God.
Dude, you're bleeding. You got a bloody hand. So it was just like you ever seen the Terminator where he takes off his hand, you can see all the ligaments in his hand, like everything moving. I'm like, dude, you need to go to the hospital. You need
to. Wow, that's awesome.
Yeah.
And then Adam, you did a terrain rescue, right? You rappelled down to save an overdose.
Yeah, the overdose. The guy that fell over the hill. He randomly took heroin and then like went over the hill. So that was me and Richie's first call together as steady partners.
Yep.
By the way.
But they force entry in Pittsburgh. They do vehicle extrication and rappelling. So like their EMS is like as good as like firemen and stuff. So they just don't get to go to fire.
Nice.
So
yeah, that's one of the benefits of having our fire department. Like, so as a fire department and a medic, we get to play in all aspects also. So it's fun.
Yeah. So do you guys like try to beat the engine there to like, make the grab before they get there?
Oh, dude. Well, yeah. When I'm on the rescue, I tell my driver, I'm like, "Hey, man, if I'm not driving and you're driving, we get a fire call or something, you better be there first."
Yeah.
I'm pulling that line as soon as I get there. That's all.
I'm gonna put it out with the water can. I'm gonna steal your toys, boys.
Don't be a hero. I ain't scared.
That's awesome.
That's
So we're going for 2.5 hours. You guys want to stop or we can keep going?
Up to you.
I don't care.
I actually got to get my son ready to bed regardless. So.
All right.
Oh.
I know. He's crazy. He's going.
Daddy duties.
Yeah. So.
That's some red hair. Woo.
Oh yeah.
What's up,
Hi,
man?
Wow.
Hi.
Hi.
She's gonna wave too.
What kind of dog is that?
Terrier mix.
What is it?
Terrier mix.
Terrier mix. My parents have
The redhead is cuter, but hey.
You got the air conditioning on down there? You guys are in shorts, right? Yeah. You guys are in shorts and everything?
Oh yeah, absolutely. Yeah.
It's so cold.
Dude,
man.
it was like in the 90s today. We didn't even go to the park. Yeah.
We're hating. We're all still in sweatshirts and long pants.
Yeah.
Hey, it wasn't bad today. It wasn't bad today.
I was gonna say I might trade it for your weather because it's not even summer yet. In the 90s.
Yeah.
It's cold, man. It's cold.
So.
It was like 65
It's cold.
Oh, see, that sounds nice.
here. I wore just the sweater. So
yeah.
Sorry everyone that I had to go. My son was going to bed, so I was like doing FaceTime. But
we should do this again in like a week.
Yeah.
We should wrap
totally.
See what you guys are doing. We'll grab some. I got a guy from California. We can get him on here.
Yeah.
Thank you.
And see where everybody's at.
I need some social contact, so let's tomorrow.
Yeah, this is good.
This really helps. That's
every day.
Like I said, I haven't seen this stuff yet, so thank you guys for pointing that out.
Yep.
No problem.
So yeah. Sorry, so I'm gonna stop recording, but yeah, thanks for listening. If you guys want to hang, we all stay and talk. So I'm just gonna stop recording because I know people are like, yo, these guys are keeping going.
All right.